Welcome back. Well, over the past year, the number of women freezing their eggs has more than doubled. But experts are now warning the procedure might be giving women false hope for a successful pregnancy.
Our next guest is a fertility specialist who says that while egg freezing is valuable, women should properly weigh up the risks and the real chances of success. Dr. Lynn Burmeister is back with us in Melbourne. Good to see you, Dr. Lynn. These days, more women are freezing their eggs than ever before. Why is it so popular?
Well, it's becoming sort of like a fashion thing. So we had Kim Kardashian freezing her eggs before she became pregnant. We've got big companies like Apple offering to freeze their workers' eggs so that they can keep working. So it's sort of more out there and I suppose more known about. And women are now taking charge of their fertility, and now they have the option to freeze their eggs. 10 years ago, when we used to freeze eggs, the pregnancy rates were really low, but now the pregnancy rates have improved with improved technology. So it is an option for women to store some eggs away for future fertility.
Just elaborate, if you could, on why the procedure could be giving women false hope.
Well, we actually need to freeze a number of eggs for there to be a chance to have a baby. So putting away 3 eggs is not probably going to work. You need at least 15 to 20 eggs stored away to result in a baby in the future. And even that doesn't guarantee you of a baby, because until we've thawed the eggs, we don't really know the quality. So we don't know whether those 15 to 20 eggs are actually even going to fertilise to become a baby. So whilst it may be a good thing to freeze away your eggs, it's not a guarantee you're going to have a baby. And I tell patients it's like an insurance policy. You just hope you're never going to have to use your insurance, but it may be there as a backup in case you don't have a baby until later in life.
But the point being, the eggs have to be viable, of course.
The eggs do need to be viable once they're thawed, and we don't know that until we thaw them.
What should women consider before going ahead with this procedure?
Well, they need to evaluate, find a good clinic for starters. So most clinics are vitrifying their eggs now. So vitrifying is a snap freezing technique. So they need to make sure that the clinic they go to is vitrifying the eggs. And then they need to be aware of the process. They will need to take daily injections for about 10 days, and they will need to have a surgical procedure to collect the eggs. And that can lead to complications as well, so they need to be aware of that. So it's something that they need to take seriously and weigh up all their options.
And there is a cost involved in that too.
There is a cost involved. Some clinics, it can be anywhere between $5,000 to $12,000 to freeze your eggs.
And then a cost to keep them as well?
And a cost to keep them, like a gym membership every year.
Yeah. Just finally, Lynn, for someone concerned about their fertility, are there other options they should consider before turning to freezing their eggs?
Well, they could have their ovarian reserve tested, so I would always start off with that. And if their ovarian reserve was good and they're in their early 30s, then I would tell a patient not to freeze their eggs at that point. But when they're heading around that 34, 35-year-old mark and they're not in a relationship, then I think egg freezing is a good option for women who are single.
All right, Dr. Lynn, thank you so much for your time again this morning. If you've got questions, you really should head to the best. Go to Dr. Lynn's website for more.